Yeah, we're gonna get it rolling here, folks. Good afternoon, good people. That sound means we're calling the Health and Human Services Committee of the Wayne County Commission to order. I'll remind people again about mic awareness is going out on the internet. We want everybody to hear, both in the room and on the tapes, the business that we're conducting on behalf of the public. Madam Clerk, what's first on our agenda today?
Commissioner Marecki?
Here.
Commissioner Dobbs?
Here.
Commissioner Anderson?
Here.
Commissioner Baker McCormick? Chair Colleen?
Here.
You have a quorum present.
Thank you. Next.
B, approval of the January 28th, 2020 meeting minutes.
Move approval.
Support.
Are there any additions, corrections, or changes to the minutes? Hearing none, all in favor of the motion, please say aye.
Aye.
Aye. Opposed? All right, we'll move on to the next item, Madam Clerk.
C, unfinished business. There is none.
Good, we can move right on then.
D1, under new business, requesting commission approval of retroactive modification forward to a collaborative use and occupancy agreement with 2 one-year options to renew with Oakwood Healthcare.
All righty, if someone from the department can join us for this item, please. Welcome, name and title for the record.
Hi, Carol. Hi, Carol Osterberry, Health Officer, Health, Human and Veteran Services.
Thank you for being here today, Ms. Osterberry. If you could speak to 2 things. One, what is the underlying contract here that we do with Oakwood? And also, please speak to the retroactive nature.
Yes, this is just the lease agreement that we have with Oakwood Beaumont. They actually are leasing space in the clinic that is located off of Eureka Road in Taylor, Michigan. They operate their Taylor Teen program out of that clinic. It is retroactive, long story short, because Oakwood and Beaumont have been going through so many administrative changes with, I went back and realized I had sent, myself and my staff, we had 50 emails back and forth trying to find out who was, the right person to really be championing this through. So it's just.
Thank you for that. Sounds like the Laurel Harder routine, who's on first. Question from committee members on this item. Now, this is another modification, because it seems like we talk about this about every 4 months with the number of modifications that have come with this contract. What does modification number 4 do?
I'm going to ask TR to.
Yeah. Well, it's in our paperwork, but I just want to have it on the public record as well.
Karen Winter from Corporation Counsel.
Your mic on, sir? Okay, good. Thank you, sir.
Yes, thank you. Modification number 4 extends the term again. The amount they're paying per square foot remains the same with it, with an option if the costs go up for them to do in-kind contributions during the term of this lease. They are sharing unused space in the Taylor Clinic that was formerly used for clinical services, and we use the WIC portion still there, and they have a synergistic effect that we refer clients to the WIC, to the Taylor Teen Program, and they refer teen mothers to the WIC program if they're eligible in the same space.
Sounds good. Thank you. Committee members, questions? Pleasure of the committee.
Move approval.
All right, we have a move and support from Commissioners Anderson and Marecki. Discussion, Commissioner Baker McCormick.
Thank you, Mr. Chair. Just clarification on the space rental. Seems like we had this conversation before. Did we last
We have.
year? Yeah.
And I think it was less than a year ago, because this is a
Yeah.
modification. And I know there was confusion when we discussed it the last time is exactly, so.
Yes, this building, Wayne County owns only our suite, and the rest of the building was developed in a joint venture with the city of Taylor with federal grants, and as the grant requirements expired, the city of Taylor sold the rest of the facility to them, and so there was uncertainty as to whether Wayne County was going to keep the building or not, because the other contract you get from here, we have to pay common charges to the entity that owns the rest of the facility.
Okay. So the retroactive, though, activity is, because it seems like this is the same issue as far as the retro.
As Carol said, the biggest problem in this particular modification is that Oakwood was unable to provide someone who could sign the contract, who could negotiate the contract. The main staff person at the Taylor facility remains the same, but he did not have the power to finalize the agreement. He was also attempting to get the correct people to do it, but it went on for many months. The longer-term thing is that there was uncertainty about whether Wayne County would continue to have our suite or would sell it, and that was why this contract has been done only a year at a time in the past, because we were exploring our options whether to keep it or not. I believe it looks like, at least for the intermediate term, we are going to keep it, which is
That's
why
what I
we're
was gonna
making it to
ask, yeah.
have the extra options in it, yes.
Okay, thank you.
So if I can say it this way, it's like we own a condo in a building.
Absolutely, yes.
We
that is
bought a part of the building like it was a condo. That building changed owners, and has new owners, and then when we went to do the modification, it was like, okay, new owners, who do we talk to? Who's the right person that we're gonna interact with around this contract?
Yes, that is very much the arrangement that we have.
Questions from committee members? It's been properly moved and seconded. With no further questions, I'll ask for a vote. All of those in favor, please say aye.
Aye.
Aye. Opposed? Are there any abstentions? Thank you very much, and we'll see you in a minute, Ms. Osterberry. For other matters, we're going to talk about what's being asked of the county for the coronavirus thing. But we have, what's the next item on the agenda, though, Madam Clerk?
Item 2, requesting commission approval of Amendment 1 to a 3-year intergovernmental agreement with Michigan State University.
If you would please join us, sir. And Ms. Osterberry, do you want to, well, name and title for the record first.
Richard Wooten, District Director, Michigan State University.
And this item involves you. So Ms. Osterberry, if you would like to kick off this item, please.
Yes, this is an amendment to the current intergovernmental agreement between Wayne County and Michigan State University Extension. It adds funding to that agreement for Michigan State University to hire as a subcontractor the Wayne County Conservation District.
Is that money, well, I'll ask Mr. Wooten. Are there other things in that 50,000 that the
Yes, there is.
co-op extension needs?
Yes, the money will really, it will allow us to provide some additional funding for our base funding for all programs in the county. And $25,000 of that money is set aside to work with the Wayne County Soil Conservation District on collaborative programming.
And then the other amount will kind of be like up to 25,000, correct?
Yes, the additional amount, our agreement, IGA, is the base funding that we receive to support all things extension. It's the money that we use to cover salaries. It's the money that we use for fringe. It's the money that we use to cover operating. That additional $25,000 will allow us to better address those costs going forward.
I believe you just sent all the commissioners an annual report. I just got something from you in the last week or two from the
Well, we've
co-op extension.
What we've tried to do is provide you with periodic information throughout the year. We're in the process of setting up meetings so we can identify specific programs that occurred in your district, so we can talk about those. So if there are gaps, we can have conversations about those. Generally, the funding levels in the urban county are significantly higher than what we receive in Wayne County, even though we have probably the most expensive program. So those dollars would do those two things for us as a part of the amendment.
Yeah, thank you for that. I encourage everyone to take a look at the co-op extension emails when we get them. It is a very broad range of services that you're offering to residents of this county. And I believe the county appropriation that's in here now is just south of 700,000 now.
No, actually, the total allocation is about $404,000. Of that $404,000, we receive about $215,000. That's the money that's captured in the intergovernmental agreement. That's the money that flows back to the university that allows us to support staff, positions, fringes, cost increase, all of those different items. The other portion of that budget is really based in Wayne County and used for Wayne County activities. There's one support person that's a part of that budget, but a significant part of that represents chargebacks that are part of the county that we have no control over.
So how many dollars, including this 50,000, does Wayne County contribute out of our budget to your programs?
If you're talking specifically about the intergovernmental agreement, it'll go from $215,000 to $265,000 for the current year. It's a one-year allocation. The new three-year agreement, it's up for consideration this year because it expires this fiscal year.
If we go back, let's say, 7 or 8 years, do you recall what the county was putting into co-op extension back in those days?
For the last 4 or 5 years, that amount has fluctuated as we've gone between three-year agreements and one-year agreements. If we go back far enough, when I was a county director, it was close to $1 million. Just to give you some idea of how we fit in terms of the urban counties, we receive about $450,000 from Macomb County in the agreement, with a total investment of almost $1 million. We receive $1.1 million from Oakland County, with about $300,000 to $350,000 committed in the intergovernmental agreement to support the programming.
And I always encourage the line of thinking that for organizations like yourself that have so many things that they can offer to Wayne County residents, that it's cheaper for the county to send you a couple of $100,000 rather than us hiring people. We can't make it go as far if we keep that $200,000 internal because we have other spending to do. So I would just encourage people to think about that in terms of how we can broaden the services to people in Wayne County through these partnerships of the folks out there. Go ahead, sir.
Also, Commissioner, for any of the commissioners, as you look at our materials, if you would like to co-sponsor an activity, I mean, it's just a matter of sending me an email and we can set you up with staff. We've worked with Commissioner McCormick on a couple of items recently, and we're excited about those. But we have a lot of different programs that can hit just about any population. And it's because of the support that we receive from the county that we're able to provide that programming.
Yep.
Again, our budget is a little down this year, but it's about $2.9 million that we invest in the county. And we can only do that because we get the base funding from the county, and we spend that off into additional investment. So as you think about the different programs that we provide, if you've got an audience, we can deliver a lot of these programs in your district.
Personally, I would love to see more kids get involved in 4-H all across the county, urban, suburban, rural, whatever. That's a wonderful Okay, questions from commissioners on this item. Commissioner Marecki.
When Commissioner Killeen just mentioned the 4-H, do you still have that fair that goes on?
Yes, we do.
Okay, what month is that?
It's generally in August.
June and August, and where was that? It was way out.
It's at the, it's in Belleville.
Oh, in Belleville.
Right.
Okay.
Now, the reality is,
At the county fairgrounds, I
right, it's the
believe.
county fairgrounds. They're a separate nonprofit association. But what they do is they allow extension, a lot of the kids are 4-H kids that participate. We have a 4-H auction. The kids auction off animals. We have some kids, actually, for some of the urban kids, we work with Pingree Farms because they have animals in the city. And that allows urban kids to have animals and take care of animals and potentially show animals at the fair. So we're trying to cover both, but that fair happens every year in August.
Okay, I went to it once. But
Okay.
it actually slipped my mind till right now. Okay, getting back to this 25,000, is this the 25,000 that last year didn't get in the budget and the woman came?
Yes. For the co-op
spoke with
extent.
us.
I always hate this. We have the co-op extension service and we have the Wayne County Conservation District. Yes,
So,
this is what it was,
as I
yes.
recall, the state gave that program 25.
Correct.
We gave it, but they only had the 25 because it got screwed up. I don't remember
Right,
how.
right.
So you guys are going to actually oversee this then?
For that 25,000, it's going to be put in our contract, and then we're going to do a subcontract with the Wayne County Soil Conservation District to provide a variety of programming across the county.
And this is the woman that I met? in the
Yes,
past? So you're subcontracting to her,
Well, to the
to
organization.
the
the
organization.
organization, but I
Yeah.
know she was heavily involved in the map. She did
That's one of the
soil, map
things,
soil,
yeah, and we'll make sure commissioners get more information about what they do, because we're also engaged now with the state of Michigan for the new budget cycle. This is another one of these organizations out there that can bring a lot of value added to the county. And this was a torturous bit of discussion. One member of Corporation Council that's not here today, you know, there's a lot of discussion about how we could put Conservation District money into the budget, and there was the feeling we couldn't do it directly, but by going through the conservation, the co-op extension, we could get the conservation money over there for that, yeah.
Okay,
And,
are they going to ask again through the state for another
Oh, yes.
25,000?
Yeah,
And
you
then
gotta-
that would go under you?
Well, actually, our understanding is that this is one-year funding, and then it'll be up, I think, to the commission to decide how they
Right.
want to move forward.
No,
No.
I was talking about the state.
Yeah.
The state had given her 25,000 either last year or the year
Going forward, the state will have their own relationship for the work they want them to do here in the county.
Okay.
It will not be going through co-op extension. For purposes of county funding, it'll go through co-op extension. But they're in discussions right now with Representatives Tate and Senator Chang. And I know they've asked, because we have 83 counties, we have about 72 conservation districts. It was the USDA that authorized conservation districts. Almost every county has one. Out of the 72 or 73 counties in the state, about 52 of them get state support. So the senator and the representative have asked them to give them all of the data for what the other conservations. There is a statewide conservation district website too, and I think they're looking at having an omnibus 50,000 to all of them, something like that, that they want to put in the budget. But we'll have the Conservation District come here and describe, once these funding issues are over, what they can do more of.
Okay, thank you.
Yep, thank you. And I would encourage my colleagues to talk to Commissioner Baker McCormick on what she's partnered on, to see the kind of things that might be available in your area too. Any additional questions on item D2?
My question was answered, I guess, as far as what they'll do with the funding, that's all.
Okay. Pleasure of the committee?
Move approval.
All right, we're gonna, Dobb move.
It's already been moved, right?
Yeah, McCormick, no, it was, but that was, I don't know. Commissioner Dobb
I will
moved it.
move approval.
For the record, Commissioner Dobb moved it, Commissioner Baker McCormick seconded. Any additional questions? All in favor of the motion, please say aye. Aye. Opposed? Any abstentions? All righty, thank you much. The budget adjustment, go ahead.
3, discussion of budget adjustments.
Did we, do we have them? Did I get them? I might not have gotten them. It gets very, well, it gets very complicated because I'm not doing the paperless thing.
D3.
No, I'm not doing the paperless thing. I copied it off, but, and as I always point out, paper can be recycled, trees can be replanted. The metals we need for electronic devices support slavery and child labor all around the world, so I'm choosing trees over slavery. Yeah, no, it's there. No, seriously, look up how rare earth minerals, the things that we need for all our electronic devices, how those are found and gathered and who's doing it. It's an ugly story. Okay, so we have 1, 2, 3 budget adjustments. Do commissioners have any questions? The first one was like a $90,000 to decertified revenue in the county community corrections fund. Is there any questions on that? Was to decertified revenue to reconcile a budget grant award. The second one was an $8,039 adjustment. And the third one was a $5,000 adjustment. Do commissioners have any questions on those? Okay, hearing none. Good to see you. Thanks for coming to the table. There you go. Got you out of the office for an hour. Okay. Next on the agenda?
E, such other matters as may be properly submitted before the committee.
Yeah, we have two of them. Commissioners, I passed out at your seat. Thank you to the Health, Human, and Veteran Services. Responded to questions we had at the last meeting about the Youth Assistance Program. Please take note on the second page that they answered the question for Commissioner Baker McCormick about the Ennis Center. And I had requested the annual juvenile justice report be submitted to the question. They answered it's going to be completed at the end of this month, and we will see it then. So thank you very much for the department. Commissioner Baker McCormick.
Yes, I'd like to thank the department for the responses. However, with the question in reference to, I don't know who
Yep, we need you then. Name and title for the record, please.
Nellie Lee, Director of Policy and Compliance for HHVS.
Thank you for being here.
Thank you for having me. I'm sorry.
Yes, so thank you again for the report. However, in the response that was given in number 4, which is in reference to Ennis Center and actually all of the other locations, I had asked about proactive activities. So the response here, it just says the Ennis Center provides the following services, but group, individual, family counseling, tutoring, recreational activities, and then critical thinking and life skills. But that does not really tell me what those activities look like. So, what are the activities that they do in reference to recreational activities? How can we find that out? Where and when? And that was really the answers that I.
Am I correct in assuming, are you looking for more of a descriptive program as to like what activities, what tasks, frequency, kind of like a larger description of
Exactly, yes.
activities? I can certainly talk to our Juvenile and Youth Services Division to see if they can retrieve a more specified description for you.
And
I
not
do
just
not
the-
have that with me today,
Okay.
but I can certainly forward that and have them follow up with
So not
that
just
description.
just the description, but the actual activities. So when they say recreational activities, what does that mean? Do they take them on a field trip somewhere and what does that look like exactly?
Okay,
Yeah, so-
I can forward that question. I
Great.
anticipate that the response may be varied due to programming and due to, what is available, due to the population that they're serving. So I don't know if there's a concrete program, like a very descriptive or, prescriptive program, but I'm sure that there is some more information to what we've provided already. I just wanted to advise that it may be dependent on availability and also the population they're serving at the time.
Okay. Thank you.
You're welcome.
And
I'll be sure to forward that information.
your name one more time, please.
Nellie Lee.
Nellie, last name?
Lee.
Yeah,
Yes,
thank you, Ms.
it all kind of flows together.
Yeah, it does. Thank you.
I was not born with that name.
Well, now I got several other questions. No, so Ms. Lee, a couple, 3 years ago at this committee, there's some sort of a citizen board that kind of monitors the foster care. Do you remember that group that came here? Were they Wayne County specific? Are you aware of such a?
Catholic Services.
No, it was.
I'm sorry.
I think it was a governmental. I can't remember now, but what I'm suggesting, yeah, I suggest to commissioners, maybe we should have a foster care day because a couple of people that are on the committee now weren't there previous, and I'm sure the Ennis Center would come over. You know, they're over on the west side. They do monumental work, and you know how difficult. I remember when I visited them, they said when we first started this like 30 years ago, we had like 2 or 3 sets of parents that were applying for each child that they had to take them out of foster care. It was like a 2-to-1 ratio of people that wanted to as compared to the kids. And now it's like a 13-to-1-ish ratio, that there's very few. It's getting less and less all the time that people are stepping forward to say, I want to be a foster parent. And so it's getting more and more difficult. Maybe it's time to have them back. We'll look at it if that sounds good to members of the committee here. And at the same time, we can issue an invitation to the Ennis Center to come talk to us specifically about what they're doing. So if you think of it, or if you have whatever this civilian board was,
I will check back
Yeah.
with our department contacts and.
yeah, just send it to me, please,
Sure.
and we'll, so.
Of course.
So again, thank you. Any other questions on the report? Commissioner Anderson.
Thank you. And Ms. Lee, I'm not sure if this would be something that you'd be able to provide, but I know I'd ask about the allocation that goes to these organizations and then a split up with youth assistance programs in separate cities. And I had asked for a breakout of that and how, for instance, the Conference of Western Wayne, how they determine how much is allocated. Is it per case or I'm just not familiar with it. It's just a way I'd like to know what the details are, how they determine how much they give to each community. I see that line item in pretty much all of them. It looks like there's the same amount going across, but I'm sure that whether it's a Conference of Western Wayne or one of the other organizations, they have a criteria that determine how much each of those gets based on something. And I'd like to see a breakout this with the number of years that we have here, the 5 years, to be able to see what that looks like for those
Sure, I'll bring that.
organizations. And that would also probably tie directly into how many of them are successful or not.
Sure, we'll bring that question back and do some research and get
Okay.
that answer to you.
All right, thank you.
Alrighty. And I think some of that will be in the annual report when they send it to us as well, I would guess. Thank you. Any other questions by commissioners? Thank you very much for being here, Ms. Lee.
Thank you.
We will ask back to the table Ms. Osterberry. I made the request. Metro Airport is now one of 20 airports in the country when it comes to coronavirus. And so I just wanted to get a little update from our health department, what is being asked of us, maybe by the federal government, what other kind of responses are gearing up or whatever it is that we need to be doing as a county health in terms of our new friend coronavirus.
Hi, Carol Osterberry, Health Officer, Health, Human and Veteran Services. So, again, I just kind of broke this down. It's probably a little more information, but, on the national level, there's still everything that's coming out. The risk to Americans is low, and that goal is to, the national goal is to maintain that low risk. Want all of you to know that. And as of February 2nd, all travelers from China were routed to, at that point, 11 airports. And yes, Detroit Metro Airport, it was designated as one of those airports. And the other thing I found, and we're getting virtually every day, we get updates. The National Institute of Health is working on a vaccine. They're projecting about 3 months out. So all of that is happening on the national level. Let's go down like to the state level. Every other day, we have conference calls with the State of Michigan Department of Health and Human Services about that local health department response and what's expected of us. Exactly like you're saying, travelers who come in realize that they are all screened by the CDC staff at the CDC, the quarantine station at Detroit Metro Airport. And then any travelers who are considered, they don't have symptoms, but have traveled from China, every day, all of the health departments around the state are getting notification to then follow up with those individuals at home for monitoring and, answer questions. I mean, the gamut is, somebody completely understands it to they're very, very scared. I mean, we're, all of the health officers were, working with our staffs, with our communicable disease staff. Here in Wayne County, the communicable disease staff and our medical director, Dr. Sharon Pani, are the ones who are really connecting with these travelers. We also are having,
If I may.
yes,
So we are being asked for some county resources out at the airport to help out with this?
no,
So is
we are
there-
not at the airport.
But are there any county resources going anywhere that the feds have asked us to participate in with regards to this? Are you reassigning staff?
Okay, I see.
Anything like that?
Yes. I mean, the answer in a sense is yes and no. Through the CDC, when someone comes in that the CDC quarantine station has then further questions about, their first phone call is to our medical director, Dr. Sharon Pani.
Okay.
And then she consults on the phone with that CDC employee. We have had 2 travelers who then, based on that phone conversation, have been, and I know one was in the newspaper, have gone then for further medical assessment. Neither of those 2 travelers then had to have additional tests taken and samples sent to Atlanta CDC for further testing. But that's why, almost out of that overabundance of caution, that phone call happens, and then the traveler is sent to another medical facility, is seen by a physician, and through the, the hospital coalition, they've been having, again, many, many conference calls. Everyone's on the same plate. What sort of screening do you do with a traveler? What questions? What do you then use to assess if they need to have? Because Washoe County, Macomb County, they have had travelers where then they actually collected samples and were sent out to the CDC for testing. We have not had any of those.
And I thank you for this, and I'll probably ask for periodic updates from the department.
Sure.
Because in these public health matters, there's a lot of, what do I want to say, a lot of panic that can take place out in the public.
Right.
A few years ago, we were going to all die of Ebola. Before that, it was SARS. Before that, it was flesh-eating bacteria. And I think it's important for this commission, and so when we discuss with people, to understand what the public response through our government is, so that we don't get into this, let's know what it is.
Absolutely.
It is a real potential threat that may never materialize based on the actions that we take. So the more, I think, ourselves in talking to our constituent and the public in general understands what the response is right down to the local level, will help people not getting to blaming the CIA. It must be the CIA's fault. But anything like that. So any question, Commissioner Marecki?
There's been no one diagnosed in Michigan, right? Is that correct?
That is correct.
They've had a couple they've tested.
Correct. I know when I was at a meeting on Friday with health officers, health officer from Macomb County and health officer from Washtenaw County. Both had had travelers who were then residents of those counties who were tested. But not, all those tests have come back clear.
You had a question, Baker McCormick? Ms. Commissioner, I'm sorry.
Yes, is there I guess, what would be the protocol or plan for if we did have a mass outbreak? I mean, do we coordinate just on a local level, or is it in matters such as,
Right.
broad?
That's a good question. I was here when we responded to H1N1, which was a large, every
yeah,
local
that one
health
too.
department. To me, it would probably be very similar to that. The state coordinates, and then all the local health departments with their public health emergency preparedness, staff and teams. We have 17 locations around Wayne County where they're called point of dispensing locations, pod locations, where we can give out, be it oral antibiotics or vaccines. Again, H1N1, it was giving out a whole lot of, basically flu vaccines to the public at some of those locations. That's what I would envision this being. They have not gotten, and we are already, we've pulled those plans out, looked at them, all of those sorts of, contacted those locations to make sure,
They're up and running.
exactly, right. We do practice with them, don't think we don't, but, all of that has been also going on very quietly or, deliberately, I should say, ever since this has started. So,
So is there like a location, well, you said there's 17 places. This isn't like a evacuation type
no.
scenario. It's just for those that have contacted whatever the
It would be
virus
if,
is, or-
if that when that vaccine is, if indeed that's the decision, when that vaccine is developed, then, like I say, H1N1 is what I'm using, basing this on, just, talking a little bit out loud, we would then receive that vaccine from the state, and then we would be holding those mass vaccine clinics.
Okay.
So this is all written down like in a public health emergency plan that the county has?
Yes,
Is that available online?
I don't think so.
Because there is like a massive, for everything from nuclear attack to, I think Homeland Security has their emergency plans for the county that may also include if we needed to evacuation. But yeah, we have, for public health emergency, we have a plan.
Absolutely.
And, I think that's part of our oversight too, which is why I asked for it. So now we understand that you're basically doing some dry runs, right, on the plan to say, okay, do we still have all these locations? Do we still have, are we really ready to go in case the CDC or somebody? And by the way, who's doing the development of the vaccine?
China,
What I found.
I'm sorry?
probably China.
Online was
Nope.
National Institute of Health,
Gee.
NIH, is working on a
Well,
vaccine.
and I just want to point out too, it did not come from the private sector. We've had some debates about how we're funding government in this country, and the funding to the CDC and the NIH have been drying up the last few years in Washington, but these are the front line of public health emergencies. We go to the public system to develop this stuff, and I think 3 or 4 months is remarkable to get that out there. And they didn't go to your Eli Lilly's or whatever of the world to do this. Is being done through a public system. Question, Commissioner Marecki?
Just want to, it's my understanding too that this virus has got like a 2% fatality rate. And many of these people that have already died were already compromised health-wise. And just like when SARS happened, I mean, the hygiene is a whole different thing over there than it is over here. So I think we have a good chance of not having any kind of horrible epidemic. But,
And we have a plan for it.
yep, and if it happens, for the next thing that comes around.
That's right, which it will.
Right.
The more interconnected the globe is, we're going to, Commissioner Dobb.
Thank you, Mr. Chair. Would it be possible for the commissioners to receive a copy of that plan, the emergency plan?
I am not sure, because there are, they're for the safety of residents and security. I'm sure you've seen the press releases. I mean, we are not releasing, and I don't think, I'll have to find out.
Okay.
And it's not trying to keep anything, it's just that, those plans, and then all of a sudden they become,
Right. Or if we can't get a copy of the plan, is there something we could set up to know if there was a public health emergency, what part that we can play in informing the public
oh, sure.
to,
Yep.
because, we are elected leaders and people might look to us for help in
Right.
those times. And we might feel very helpless if we don't know any part of the plan
Yeah.
or what
Yep.
to tell people in those times. So,
Well, we
thank
just
you.
had Corporation Counsel walk out of the room, but they might be able to express an opinion they might be able to express an opinion on what is available and what's not in terms of that. Because, if you release all of this and you have a public emergency out there, nefarious folks are going to be, oh, that's the 17 places, let's go there. So to the extent that we can, or some sort of a briefing for commissioners, because I think it is good that the commission does understand either how well or how poorly planned we are for these things.
Hey, T.R. Winter from Corporation Counsel. To the answer about having a briefing, yes, we definitely can do that. With regards to the plans and things like that, as Carol said, we would have to look at it because the public health code for the state is set up in some ways so that we are a miniature version under the public health code of the state's health department, and certain materials we are required by law and regulation of the state to use the state's guidelines and or seek the state's permission to do things. For example, when we investigate public health matters, the state has enforced something called investigative information privilege, where even if someone's involved in a lawsuit, say between two parties, certain parts of the investigation are not released, because the principle on that is that we and the state want people to feel free to call and complain if they think there's unsafe food somewhere, or they think there's something unhealthy in a house. They don't want it to come back that this person called in and snitched or something like that. So we would have to look at those kind of things, but certainly with regards to giving a presentation and a briefing of what is going on and what the general plan for the county is and what our reaction is, we can do that. And just an additional complicating factor that is also something we can discuss is that both the state and the federal government have indicated that because of the federal declaration of this being a public health emergency, the feds may be taking more of an activist role, but also more of a red tape regulation cutting mode, in that they are saying the federal power that they've assumed can be given to local governments and states to do things that normally we wouldn't be able to do to respond to this disaster, as long as it's done in a reasonable and well thought out effort with regards to the standards of what should be done. And we can certainly discuss that as well.
And so it occurs to me as we're discussing here, I mean, a couple of things. Perhaps some sort of like a PowerPoint, where you go down and say, when a national health emergency, right, this is what the feds do. They kick the states kick us, or however that works, for what the appropriate, just so people see what because it is state, federal, and local, just to see what that hierarchy is and what the infrastructure is to respond to it. Of course, there's going to be, so, I could either see at this committee and asking other commissioners if they want to come in and see that, or seeing if we have it like at a committee of the whole. But I think these things are important, that the public understand the infrastructure that government has behind these kinds of emergencies, that it's not just some haphazard kind of a thing. So I'll take the temperature of committee members, but not now, but maybe we'll work on something like that, because that's going to be true no matter, I mean, if this one passes in 3 or 4 months, H1N1 will be back, Ebola will be back, you know, there's another thing going around in Africa right now that's fairly well contained that people are saying is more virulent than Ebola, and it hasn't emerged too much yet, but it is there. So just for general public health emergencies, what's the response? How do we, you know, in general terms? So maybe we should think about doing that, and I'll talk to you more about that, Carol, and
Yeah,
what that
sure,
might
and-
entail.
Right, and, you know, I think also then, you know, like you've touched on, even like the Homeland Security Department and how
That's
we
right.
interact with them. I mean, that's all, it is very, very interconnected. You know, depending on, it's just always interconnected, and depending on the event, you know, is really where, you know, how those, how much or little, but we always are interconnected with them.
But I think to ask the basic question, when an emergency response is needed, are we ready? That, the basic question. Commissioner Dobb?
And to that point, and I don't know if, I guess it might apply to this committee, the Homeland Security, if, you know, if we had another major issue with going off the grid, and like, you know, what would we do in that situation? What, you know, as elected officials, as leaders of the community, what can we tell people to do, to expect from Wayne County?
Yep.
So,
Yeah.
yeah.
And even in term, well, this is a long way down the road, but with Homeland Security and that kind of stuff, even having a little bit of a road show so you can bring them out to your district and say to your constituents, if you want to know what Wayne County's preparedness is for an emergency, either Homeland Security or public health, just so people know, right? That absent from any ongoing emergency. Commissioner Marecki?
I can't remember if it was this committee. We've had Homeland Security come to something about, you know, the nuclear reactors and all their, is that here? Or is that under?
Well,
We've had this paperwork for some of
right,
this.
yes. So because the Fermi nuclear plant is part of Wayne County, is within that 10-mile EPZ, yes, every 2 years, both Public Health and Homeland Security go through a graded exercise from FEMA, actually comes in and grades that.
Okay.
And, you know, it is kind of interesting how much, you know, there is that interconnection between these two departments and what we, you know, our response to, you know, if there were to be an event out there.
Was your presentation, we've had this presented to us before. I don't know if it was
I-
this committee or not.
Right, I don't think I was part of that. I just, you know, I know how much, you know, like I say, interconnection and participation from public
Well, it's
health
a big,
every 2
thick-
years.
Big, thick
Yes, it is.
file.
It might have been over in the Public Safety Committee. that-
Right, might have.
Yeah.
Okay, thanks.
But I think Commissioner Baker McCormick.
And to that point, to Commissioner Dobbs' point of some communication to the commissioners, do we have, or can you prepare like a one-pager that we can actually give out that is not, or does not contain closely held information?
Oh, now you're not, okay, so you're not talking like just on the coronavirus, but you're just talking about
general,
general.
yes,
You
that
know,
we
like,
can-
like I said, we'll have to just see what it is we can, you know, in
yeah.
working with, you know, them and what, yeah.
Okay, great, thank you.
And I do know that our public information officer has been very diligently, again, every day updating the Wayne County website and, you know, like he did with the action level
So
exceedances.
where should we go look for the updated information that we can also share with our constituents to say, if you want to know what Wayne County's up to, go to this, here's the link to our part of the website?
I think, is there some, I honestly haven't looked recently. I thought there was something right on the front page that was a, you know, that then got you in further.
Okay, but it is being updated daily.
Mike is, yeah.
That would also be good to put out there. Things, some of this stuff travels like a virus through the public to get maybe a little overexcited about some of these things. Thank you very much for spending some extra time with us today. Any other questions by committee members? Before we adjourn then, two things have come up today. Perhaps a presentation overall on what an emergency response looks like. We'll be looking at that. Plus having a foster care kind of a meeting to get the Ennis Center here and whatever that public board is. Madam Clerk, what's next on the agenda?
Public comments.
Any member of the public wish to address the Health and Human Services Committee? Any member of the public? Any member of the public? Before we adjourn, I'd just like to recognize the former Commissioner Shannon Price has joined us in the back corner of the room. Good to see you, Shannon. Pleasure of the committee. There you go, that thing. Without objection, we stand adjourned. Thank you, everybody.